Welcome to the Pregnancy, Birth and Recovery podcast, the place where you learn how to prepare your body for birth and recover well afterwards. I am Kath Bequee. I'm a pelvic floor physiotherapist, mum of 3, and founder of Fitness Mama. Each week, I share practical, evidence-based tips to help you feel strong in your body, confident and supported, whether or not you're pregnant, preparing for birth, or navigating life and recovery after having a baby. From pelvic floor and core rehab to birth preparation to returning to exercise safely and boosting your postpartum recovery, this podcast is your guide to a healthier, more empowered and stronger pregnancy and postpartum recovery journey. So let's dive in. Hello, welcome back to the Pregnancy, Birth and Recovery podcast. Today, let's chat about exercise in pregnancy. I actually did this episode, it was over 2 years ago now, and it is to this day one of the most popular episodes on the podcast. That initial episode was done in conjunction with an obstetrician, Dr. Tom Cade, and I'll pop the links in the show note if you want to check that out. Today, it's a solo episode, but I wanted to repeat it because it has been a few years, and today is more of a, physio slant on it, but we're going to discuss benefits of exercise, what are safe exercises, what are exercises that perhaps I shouldn't be doing in pregnancy, the common question, are abdominal exercises okay to do in pregnancy? Another really common question, can I run in pregnancy? I'm going to talk about do I need to do pelvic floor exercises if I'm having a cesarean? And going to finish off with my top 3 non-negotiables when it comes to pregnancy and exercise that I recommend to all my patients and members who are pregnant and wanting to stay strong during pregnancy. So let's quickly discuss first, so that we're all on the same page, really brief overview, benefits of exercise. I think we all know these. There's so many, and I won't mention them all today. Some of the big ones are it helps to reduce your risk and helps prevent the chance of getting gestational diabetes. It helps to improve your overall postnatal recovery, including pelvic floor recovery. And I love this. Let me repeat that. By exercising in pregnancy, your pelvic floor is going to be stronger in postpartum. So we haven't even talked about pelvic floor exercises, but we know from research that exercise in general helps our postnatal pelvic floor recovery, which means you're less likely to be leaking, hopefully reducing your risk of prolapse, all those pelvic floor issues postpartum. And don't forget the overall health benefits to mum, the cardiovascular, mental health, bone density, safeguarding against aches and pains, so much. And I know firsthand when I had my second pregnancy, pelvic girdle pain, I had it really bad. We were moving house, I had a toddler, and developed pelvic girdle pain. And my mental health took a huge dive. The lack of sleep, difficulty getting comfortable in bed, difficulty doing normal exercises, not being able to care for the toddler, the guilt. I know when I exercise in the morning, even to this day, my youngest is now 8, 11 and 13. When I exercise first thing in the morning, I feel better. I think, that we know those endorphins have been released. I feel like I'm a more patient mum. So everyone's different, but everyone likes to exercise at different times of the day. But to me, if I can do a workout and then a coffee, that's my go-to. I'm not saying it's everyone's, but it can be so helpful. Another patient just recently, when I discussed the pain aspect, I had a patient relatively recently who had an episode of back pain 2 years prior to getting pregnant for her first time. And when she got that episode of back pain, I think there was some disc involvement, there was pain down the leg, like it was a pretty significant injury. And her normal exercise took a back seat and she became quite deconditioned. So then she became pregnant. Fast forward 2 years, her pain had settled big time, no pain on a day-to-day basis. And when she hit the 20-week mark, however, her belly was starting to get bigger. Her back pain unfortunately returned. It returned with vengeance, with postural changes, her mechanical changes, the way she moved was changed, muscles were stretched. Our body is different during pregnancy. And she came to see me in the clinic, and I assessed her back, assessed her body, and first session started her on a really simple program at home to help her back pain, to help with the muscles that were stiff, to help with the muscles that were weak. So really, it was a really basic program, some stretches and some exercises that she could do at home because she was really busy. She was working full time. And I got an email from her just last week, and the pain had reduced, her back pain had reduced. She was feeling heaps better. She was sleeping better. And all just from literally 10 minutes of stretches and exercises at home. So I think sometimes when we talk about benefits of exercise, we can tune out a little bit because we're thinking, oh my God, I just don't have time to go and do an hour of exercise. Or we think of something that's really high intensity or just time consuming. And it doesn't need to be that way. Okay, so let's discuss safe exercise. So when we're looking at the RANZCOG guidelines, so these are the Royal Australian New Zealand College of Obstetrician and Gynecology, and they quite regularly update their guidelines for exercise during pregnancy. And the most recent guidelines, it's pretty standard. So we want to include, a gradual warm-up and a cool-down with each session. We want to avoid, and actually this is important, we do want to avoid exercising in high temperatures and humidity. So if it's really hot, perhaps we need that air-conditioned room, and also ensuring we've got adequate hydration. We have I feel silly actually saying this, but I am talking about safe exercise. So avoiding exercises or activities with the possibility of falling. So horse riding, skiing, certain sports where you might have impact trauma to the abdomen, even cycling, there's a bit of a question mark. It probably depends on your confidence, how many cars are on the road, something to have a chat to your doctor about with any of those activities where there is a possibility of falling. And then it is pretty much, let's perform exercises to strengthen your pelvic floor. Let's include some weight-bearing exercises and strength exercises. And let's listen to our body. So this is where research is changing quite a lot. For example, there is currently still a bit of a question mark over whether or not high intensity exercise is safe for pregnancy. A few years ago would have said we need to keep it in the moderate intensity, make sure you can have a conversation while you're exercising, do that talk test. I'm sure you've heard me talk about it before. There is a little bit more of a question mark over and thoughts that in some circumstances, higher intensity is safe. My recommendation to you is if you do, let's say your pre-pregnancy, you were participating in a regular high intensity exercise. For example, let's say take running, for example, and you're a really keen runner and you've been doing it for years and you've got a lot of experience at it. If you want to continue running at that intensity, I do recommend 100% you get your check-in with your healthcare provider to get that tick of approval and to get that personalized advice. For the majority, 99% of you listening today, work at an intensity where you can hold a conversation, but you might feel a little bit puffed out, but you're not gasping for air. The 1% that do want to really do high intensity, I'm not saying no, I'm just saying check in with your healthcare provider. Again, if I do this podcast in a couple of years, we might have research to show that it's safe for mum, safe for bubs. That research is starting to emerge. I'm not yet sure about the quality of the research yet. And the RANSCOG guidelines have not yet changed. Okay, so safe exercise. Let's include some strength, Pilates, cardiovascular. You know what? Let's do the best exercise is the one that you enjoy, the one that you're more likely to do on a regular basis. However, I am a little bit biased. I 100% think that all women with pregnancy and postpartum would benefit from some type of Pilates exercise. The reason I say this, and I know I'm biased, absolutely, but Pilates it's an all-in-one exercise. It can help manage your aches and pains when done properly with the right guidance. It can help to strengthen your pelvic floor and core, which a lot of things don't target specifically. It can absolutely be a form of strength exercise too. There's a lot of resistance you can do with Pilates. It can not be a strength workout, but you can absolutely make it a strength workout too for bone density and muscle strength and all the rest. And this is important. It's so good for the posture. Think that upper back, all those upper back muscles, setting us up for breastfeeding, setting us up so that we have that strength in our postural muscles, in our upper back, to be able to hold bubs, carry bubs, lift bubs, nurse bubs. I see so many women in this early postpartum phase who develop mid upper back pain just because the demands on new mum life are incredible. Our boobs are bigger than ever before. We're weaker than ever before in our abs. We're holding a dead weight in front of us. Not a dead weight, but you know what I mean? Like it's heavy weight. Even if they're just a little bubs, when you're holding them in that one position, let's say you're breastfeeding, you're holding them for quite a long period of time. It can be, up to an hour. What starts off as a lightweight becomes a really heavy weight. And I see so many women who need some hands-on treatment, massage, gentle work through that upper back to help reduce aches and pains as a result of it. So let's set ourselves up in pregnancy for that. Let's not wait till we're postpartum and think, oh my God, I need help with my upper back. Let's do that postural work in pregnancy. If you're not sure where to find out where to do this exercise, by the way, Fitness Mama, we've got it all. So let's say you're a keen runner or walker. Brilliant. I love that exercise. It's free, gets you out in the fresh air, but it doesn't necessarily target what we've just talked about in terms of the postural side, the abs and the pelvic floor and the core. So if you want, I think Fitness Mama is really perfect complement to whatever you're doing. Even if you're going to the gym a couple of times a week and you lifting weights, doing a couple of home-based workouts that are focusing more on posture and core can be amazing. Anyway, let's move on. I do think getting into whatever it is, it's finding that rhythm that's the best. That's probably the hardest. It's so easy for me to sit here and say, we need to do X, Y, Z during pregnancy. We need to exercise regularly and walk and blah, 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 blah. I get it. I've got 3 children. Like life is busy. We might be working full time. You might have toddlers. You might be a single parent. You might have a partner who's away working interstate, overseas, and you're on your own. Like it's not always simple to get that consistency. But I do think it's possible. So when my husband travels a lot, he's away every week for 3 or 4 days at the moment, doing a lot of interstate travel for his work. And when I don't do my normal exercise, the first thing I get is my weak spot is my neck and upper back. And I get neck and upper back pain. And I might have mentioned this on the podcast recently, but a few weeks ago, after a few days, I was thinking, oh my gosh, I think I need to book in with one of the physios I work with for some treatment because I can't exactly treat my own neck. And so I was about to ask, physio, do you mind just spending 10 minutes on some mobs on my neck? When I thought, I just stopped myself and I was like, what am I talking about? I know exactly why I'm sore, it's because I haven't been doing my normal exercise. And so I wasn't able to do my normal Pilates because my husband was away. So I made sure I did some home-based stuff. I did it that evening. I did it the next morning, just 5-10 minutes. And within 24, 48 hours, the pain was gone. I'm not saying that will happen with everyone, but I'm just saying to highlight that exercise is not just about, we're not just exercising for exercise sake. If you want to really support your recovery after birth and feel strong again, Fitness Mama is for you. It's a physio-led platform designed to support your pelvic floor, core, and whole body. And here's the key part. It's actually best to start during pregnancy. Inside Fitness Mama, you'll find pregnancy-safe workouts, pelvic girdle pain support, and guidance that sets you up for a smoother postpartum recovery without guesswork. You can try it free for 7 days, no pressure, no obligation. Head to fitnessmama.com to start your free trial. We're exercising so that we feel better. And for me personally, this was a huge transition. Before I had any of my babies, I thought that exercise was like going for a run or, meeting up with a friend and going for a nice long walk and having a coffee at the end of the walk, a good solid hour. And when I had my first baby, I realized that my whole concept of exercise totally changed. If I'm being honest with myself, before I had any of my babies, exercise was probably more about, I wanted to be healthy and everything, but it was probably more about my appearance. I'm being totally honest here. Just staying strong, looking good, you know how it goes. But once I'd had my babies, exercise changed. For me, it was no longer about looks at all. It was all about how it made me feel and how I felt after doing the exercise, and no aches and pains, and better in my mental health, feeling more like me again, not just like a mum who is a milk making machine. It totally changed my whole concept of why I exercise. And yeah, matrescence is a funny thing. Matrescence is the becoming of a mother, and it's not overnight. You don't suddenly become a mother once you come home from hospital with your new baby. Matrescence seriously takes years. Okay, I know I'm going on a tangent. Right. So that was we've talked about benefits of exercise, safe exercise. Before you tune out, let's talk about what exercises you shouldn't be doing. A really common question. Another common question was, are abdominal exercises okay, and can I run in pregnancy? Also I wanted to talk about pelvic floor exercises. Are they required if you're having a cesarean? So stay with me. Right, I will try to skip along as quickly as possible. Okay, so what exercises shouldn't I be doing? This has changed for me. Historically, I probably would have said no lying on your back to exercise and no high intensity exercises, along with all the unsafe exercise and, making sure you're exercising in a cool environment and lots of water and all the rest. But these recommendations in terms of lying on the back, not lying on the back and high intensity, they're changing. Look, I'm not confident enough to say on air it's safe to exercise lying on your back, but I am pretty confident in the next 6 to 12 months with the next research update. I think there's been some recent research come to light. So watch this space. But in the meantime, you know what? There's a million exercises that we can do not lying on back. And I know once you get to a certain stage of pregnancy, lying on the back just isn't comfortable and the belly is too big anyway. For anyone who's not aware, the whole concept of not lying on the back comes from the fact that it is thought that the weight of your fetus, the weight of your baby, pushes on the blood vessels that supply the baby. But as I mentioned, I don't think it's great quality research at this stage. Correct me if I'm wrong, but it is starting, as I said, there's a question mark over that. So look, let's just say from the second trimester onwards, perhaps don't lie on the back to exercise. But watch your space. High intensity as well, we've already talked about. Now, abdominals, this is interesting. Again, there was a time when I said, let's perhaps back off on the abdominal exercises, especially if you have some coning or diastasis, abdominal muscle separation. However, this is also changing. Based off recent research, I still believe it's not a time for sit-ups, because sit-ups, you can, like, if you've been pregnant before and you do sit-ups, it is really hard not to get that coning. However, we also don't want to avoid abs altogether. We want to do a beautiful combination of abdominal exercise in pregnancy. Let's think obliques, rectus abdominis, your deep abdominals. I guess similar to not lying on your back, I still maintain perhaps don't do sit-ups in pregnancy, but there's so many other exercises we can do to exercise the abdominals. 4-point kneeling, high kneeling, standing, side lying, like there's so many. Again, if you need some support in this area, Fitness to Mama has it for you. Pretty much every exercise I do with Fitness Mama requires some sort of abdominals. But anyway, the main thing, if you take nothing else away from this episode, this is one thing I want you to take home. I still maintain, in terms of what exercises shouldn't I be doing, the one I still am absolutely happy to maintain in terms of the recommendation is just when lifting high loads or doing any high strength work, just being aware that it's not a time we want to be doing a lot of breath holding and bearing down through the pelvic floor. For example, grunting. So if you're lifting weights with high loads, high resistance, we don't want that. I don't know if you could hear what I did, but I took a breath. It was like a Valsalva. I took a breath and I was pushing down through my pelvic floor. We want to make sure, if we're lifting weights and high loads, we want to make sure we've got the right technique and not straining down through the pelvic floor. Trust me, those pelvic floor are already under enough load with the weight of your baby, the fluid, all that extra weight going through the pelvic floor, the hormonal changes. Like, it's just not a time to be straining through your pelvic floor muscles. Just like I say, it's not a time to be straining with constipation, which is sort of the similar action. If you constipation and lifting up heavy weights in a poor way. So if you do like weightlifting, just make sure you got the right technique. Check in with just someone who knows what they're talking about, whether or not it's a personal trainer at the gym. Make sure you're not breath holding. A simple rule of thumb is if you can breathe through the movement, you're doing okay. Okay, nearly there, ladies. Are ab exercises okay? I think I've answered this. Yes, yes, yes. We want to do lots of abs. That's good. Abdominal muscles, amazing. But technique is the key. We want that nice range. We want to be aware of doming. I'm not saying if you're doming, which, by the way, it's like the Toblerone effect. If you do a sit-up, if you're getting up out of bed and you notice like a peaking in your abdominals, that's what we mean. It's that gentle separation of the abdominal muscles, which is totally normal and natural in pregnancy. In fact, 100% of women will have some degree of DRAM, diastasis rectus abdominal muscle separation, by the end of their pregnancy. Your abs have to stretch as your belly gets bigger and your baby gets bigger. But if you do have doming, we just want to check your technique. Make sure the exercise is the right level for you. Not straining, we're not breath holding, we're recruiting the right muscles. And there's so many great abdominal exercises to support a DRAM. Again, historically, I feel that mainstream advice has been to avoid abs during pregnancy, but we know this is actually detrimental and we want to be 100% doing abdominal exercises. If you're unsure, please check in with your local women's health physio or join Fitness Mama, where I chat through technique with all exercises inside the app. There are free 7-day trial. Okay, last two questions. Can I run in pregnancy? Yes, absolutely. With a few caveats, like a few things to be aware of. So have that tick of approval from the medical team. I'm making the assumption you've been a runner pre-pregnancy and you're well experienced at it, because I don't think it's a time to be taking it up as a new sport or new activity, which I don't think you'd be doing, but just had to say that. Also, if you are a keen runner, perhaps consider a pelvic floor assessment in your pregnancy, as it has been thought that runners, and I guess anyone who's strong, fit and active, might have higher pelvic floor tone, which we want to support to ensure the pelvic floor is primed for birth. We want to make sure we know how to relax those muscles and get those muscles prepped for birth, which is a whole other topic. And scroll through the podcast episodes. I've talked about that lots. So I had a patient relatively recently in the last 6 months who was an absolute keen runner, and she was keen to keep running throughout pregnancy. Her OB was happy. I was happy. We did assess her pelvic floor, and we found that her pelvic floor muscles were super strong. But initially, she did struggle to release that muscle tension. So she had what we call high muscle tone. But with some prompting and with that assessment, she was like, oh, I get it now. Like, I didn't realize I was holding that muscle tone. And just with a few short prompts, gave us some exercises, and it helped her awareness in this area to improve. And when I next assessed her in her 3rd trimester, her pelvic floor had improved so much. It was still beautiful and strong, and it was able to fully relax, which we want as the baby's head comes through that birth canal. We don't want that a co-contraction. We don't want a muscle that's not relaxing. So she went on to have a vaginal birth, really good recovery. She's back running. She's now 6 months postpartum. I have had a conversation in one particular OB in mind, obstetrician in mind, who said they are always a little bit more aware of runners, really keen runners, because her thought, I don't know if this is based off any evidence, but her thought was that sometimes there was some difficulty with birth. She always encourages her runners to have that pelvic floor assessment if they want to have vaginal birth. Like, that's just her go-to. She said, if I see any patients that come in to see me and I'm their obstetrician, I'm 100% saying, if you're a runner, absolutely go see your pelvic floor physio, because she feels it helps so much with the birth process compared to when she didn't encourage her runners to see a physio. And that's not evidence, it's just one conversation with an obstetrician. But it was a fascinating conversation. Okay, we're so close, ladies. Do I need to do pelvic floor exercises if I'm having a C-section? Yes, absolutely. Unfortunately, cesareans aren't protective of pelvic floor issues. They are a little bit more, they are protective of more protective, I won't say always, but more protective of prolapse concerns, but they're not protective of the urinary incontinence. And in fact, by the time we reach menopause, it doesn't matter which way you've had a baby, vaginal or a cesarean, we're all at the same risk of each other with the leaking side of things. And I've seen many women post-cesarean who are leaking. So yes, absolutely. You might not have weak pelvic floor muscles. Maybe they're overactive. You can have weak and overactive pelvic floor combined. Sometimes it's not a weakness issue that's causing leakness. Sometimes it's an overactivity. It does get a bit complex. So yes, you know what? If you're pregnant, if you've got the resources and money to be able to do it, absolutely go have that pelvic floor physio assessment with your private physio. If finances are tight, there is access to the public health services available. Unfortunately, there might be a really long wait list, but your GP might need to refer you as well to it's called the local continence clinic. And because there's such high wait lists, they do tend to prioritize the women that really need it. So unfortunately, what we're talking about is proactive physio, like preventative physio. Unfortunately, you might be a bit further down on the wait list, but every healthcare system's different. So if you're unsure, check in with your local pelvic floor physio or a GP. Okay, let's finish off with my top 3 non-negotiables. I recommend all my members and clients when it comes to exercising in pregnancy. Number 1 is find something that's just easy and that you enjoy, because consistency is number 1. Consistency might mean 10 minutes 3 times a week. Consistency might mean every single day, 40 minutes. So consistency is different for everyone, but over 3 to 4 times a week, if possible. Health guidelines actually say on most days. National guidelines for exercising are no different whether or not you're pregnant or just a normal person. And they're up to, oh my gosh, I think it was 300 minutes. I didn't check this. I think it's 300 minutes per week, which is nearly, it's about 40 minutes per day, over 40 minutes per day. So ideally, if you can do something every day, but if you can only do something 3 days a week, but that's consistent for you, I'd much prefer 10 minutes 3 times a week rather than 1 hour twice every 2 weeks. So find something that's consistent. And again, I know I'm biased, but this is where the home-based fitness mama can be amazing, because you can do 10 minutes easy. There's lots of those short workouts that you can do at the end of the day, at the start of the day, in your lunch break if you're working from home, just so that it doesn't feel like a massive thing on the to-do list. Okay, other non-negotiable is it please include some pelvic floor and core. This is probably your weakest link post-birth. This is the area that's had the biggest impact, the most stretch, the biggest change in function. So please include some pelvic floor and core. So if walking's your main exercise, amazing. Let's perhaps include a couple of pelvic floor and core sessions per week. And my non-negotiable number 3, get a pelvic floor assessment or input from your local women's health physio. If you're based in Melbourne, I'm at Hatched House in Hawthorn. If you don't know who to go to, feel free to send me a message on Instagram at kathbequee.physio. I have quite a large network of pelvic floor physio, women I know from all my years as a physio. I won't tell you how many years, 20, 21, too many, lots of years. Anyway, send me a DM. I can help point you in the right direction. I'll do my best. As always, if you want to join us for a free 7-day trial, head to fitnessmama.com. Nothing to lose, everything to gain. Thank you so much for joining me today. If you have a pregnant friend who you think might enjoy this episode, please send it to them. It's the best way that this episode can grow. I don't run any ads to it. It's a labor of love, and I love it, and I don't want to let it go, but it's really helpful if you can help me out. Thank you, ladies. Have a great day. See you next week. Thanks for listening to the Pregnancy, Birth and Recovery podcast, brought to you by Fitness Mama, your app for home-based, physio-led pregnancy and postnatal workouts. If you found this episode helpful, please tap follow, leave a quick review, and share it to your stories. Tag at kathbequee.physio. I'd love to connect and cheer you on. And don't forget to check out the free trial at fitnessmama.com/free to start feeling confident, strong, and supported today. Until next time, remember, a strong body, a confident birth, and empowered recovery is something you deserve. This podcast is for informational purposes only and is not a substitute for individual medical advice, diagnosis, or treatment. Please consult your healthcare provider for your personalised guidance.